This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. A team from Jefferson Regional Medical Center decided it was possible to get to 0 ventilator-associated pneumonias. Here's how they accomplished it.
It is possible to get to 0 ventilator-associated pneumonias. When we first started this project, we honestly believed it wasn't because we were doing everything we were supposed to, and we still had 11 ventilator-associated pneumonias. We were convinced that our patients were sicker than everybody else's. We went back to the drawing board. We developed a multidisciplinary team that consisted of registered nurses from the ICU, the respiratory therapists from the ICU, and our PharmD. The cost of a ventilator-associated pneumonia estimates are anywhere from $20,000 to $40,000. That's just financially. That's not the hardship on the patient, the increased mortality, the increased morbidity. We had a timeline and a work plan and an action plan, and everybody had a specific piece of that project to complete. We installed hand hygiene canisters outside of every patient room.
How you doing?
We went to continuous above the cuff suctioning on all of our endotracheal tubes.
On our ventilator sheets now, we've included a checklist for the therapists as they do their vent checks every 2 hours that you will address the high-low tube. You need to check it, you need to flush it. This is all just to keep this tube patent for you.
We developed a mouth care protocol.
And I'm going to kind of brush around your teeth a little.
And taught them that they had to brush the teeth twice a day to remove plaque and bacteria from the mouth. That the head of their bed is elevated, at least 30 degrees. The pharmacist developed a sedation protocol for us to use.
Part of our sedation protocol here at Jefferson is to make sure that we take you off your sedation once a day just to assess how you're doing. It looks to me like you're doing pretty good.
The respiratory therapist developed a weaning protocol for the patients.
Good morning, Craig.
Good morning, guys. Hi, Craig. How was he doing last night?
And meet with a nurse every morning and go through that checklist.
We have him on CPAP. He's met all the criteria. I think he's going to be extubated this morning.
I sat with our medical director and we developed a ventilator bundle, a physician order set that we use for all of our patients. Same thing every time, every day, every patient. When we first started our process, we had 11 ventilator-associated pneumonias. So we implemented our protocols and we increased to 13. This showed us that we did have to get back together as a team and everybody needed to be on the same page. The next year we had 1, and we have not seen a VAP in the ICU since first quarter of 2009.